The debate over dietary fats continues to evolve, and recent findings suggest that some popular narratives may be misleading. While many health-conscious individuals are shifting towards saturated fats like butter and beef tallow, believing them to be more natural alternatives to seed oils, the science paints a different picture. A large-scale study published in JAMA Internal Medicine has added to the growing body of evidence linking high consumption of saturated fats to increased health risks, including cancer, heart disease, and overall mortality. Using data from the Nurses' Health Study, which tracked over 220,000 adults for nearly 30 years, researchers found that individuals who consumed the most butter had a 12% higher risk of developing cancer and a 15% higher risk of all-cause mortality. On the other hand, those who consumed the highest amounts of plant-based oils had significantly lower risks, 16% lower for all-cause mortality, 6% lower for heart disease-related deaths, and 11% lower for cancer. Even small changes appear to make a difference, as replacing just 10 grams of butter per day with plant-based oil was associated with a 17% reduction in cancer-related deaths and overall mortality. These findings reinforce what nutrition research has repeatedly suggested. Diets high in saturated fats contribute to long-term health risks. While it is true that no single study can provide absolute proof, the consistency of these results across multiple studies makes it difficult to dismiss the dangers of excessive saturated fat consumption. The claim that natural fats like butter and beef tallow are inherently healthier than processed seed oils is not supported by strong scientific evidence. Instead, research indicates that unsaturated fats, including those from canola, soybean, and olive oils, are associated with better health outcomes. Of course, nutrition studies have their limitations. Self-reported food intake data can be inaccurate, as people may forget, omit, or misrepresent what they eat. Additionally, lifestyle factors such as exercise, smoking, and overall diet quality can influence health outcomes, making it difficult to isolate the impact of a single dietary component. Another limitation is that all participants in this study were nurses, which raises the question of whether the findings are fully applicable to the general population. However, despite these challenges, the broader pattern remains clear. Excessive consumption of saturated fats is linked to a higher risk of disease and death. For those seeking a sustainable and effective approach to dietary fats, balance remains the key. While there is no need to eliminate saturated fats entirely, prioritizing unsaturated fats while moderating intake of butter and other animal fats appears to be the safest choice. The idea that saturated fats are unfairly demonized and that seed oils are harmful is not well supported by current evidence. Instead of following extreme dietary trends, focusing on a well-rounded intake of fats, including those from nuts, seeds, fish, and plant-based oils, is the most scientifically sound approach. While moderation may not be the most exciting health trend, it is the one that offers the greatest long-term benefits.